Good morning. Welcome. Nice to have you all here. My name is Forney Fleming. I'm the director of the MS in Healthcare Management degree program, master's level program here in the Jindal School of Management. This forum seminar today is actually the second in what will be a series of seminars that are designed to try and answer questions being asked by the business community, particularly small business, who does not have the normal resources that larger organizations will have. And goodness knows there are a ton of questions out there, aren't there? And there will be many more in the future. Here in the Jindal School of Management, this is a major resource for tracking what is going on in the world of healthcare. We are really functional mainly at the strategic level. We have several programs that are designed for educational purposes. The program that I run, which is a Master of Science in Healthcare Management, is designed to train administrators and leaders in numerous arenas of the healthcare field. In our executive education program run by Dr. John McCracken, we have a master's level business program for practicing physicians. To give you an idea of how popular that is, there's a 2-year wait list for physicians who want to make the transition into the managerial ranks. We have a undergraduate concentration now in the School of Management, 5 programs dealing with healthcare management, which is expanding. And we also have multiple programs in leadership and certificate programs in conjunction with Southwestern Medical Center. So lots of resources here at UT Dallas that are devoted to following the healthcare arena. From the standpoint of academia, it's really been very, very interesting and quite fun. Over the last several years in our classes, we have tracked, first of all, the presidential campaign between Senator McCain and Senator Obama. Following that, we followed the battle that went on within Congress for the passage, ultimately, of the ACA. Then following that, we followed the Supreme Court battle for the ACA to see which parts of it were actually going to become part of law. And now we're at the next stage. Although the law itself was actually passed in 2010, the vast majority of the big components of it do not begin to be implemented until January of 2014. So they're coming up. They're on the horizon. And they include things such as the individual mandate and the exchanges, which are now incidentally called marketplaces. Changing world, changing environment. We're delighted to have our guest speakers. You will notice there are 2 speakers here. Unfortunately, Ms. Daniel had a family emergency that came up, so she will not be able to join us today from Austin. However, both Joyce and Jeff have been gracious enough to expand their presentation, and they will be covering the issue of the exchange/marketplace that Ms. Daniel would have covered otherwise. So we will not slight you in that regard. A couple of just broad-based ideas about the world of healthcare, where it is, and where it is going. Before I get into that, may I make one request? For those of you with cell phones, would you switch them either to vibrate or silent mode so we're not picking you up during the rest of the presentation today? I'd appreciate that. The world of healthcare is on the cusp of undergoing tremendous changes. I think that 10 years from now, we will look back on our current healthcare system and we will not recognize it either from the standpoint of how healthcare is delivered or from the financial standpoint, how it's paid for. Now, the ACA itself is a component, but I think it serves mainly as a catalyst for change because the real engine that is driving the need for change is cost. Cost has been totally uncontrollable for many years. Essentially, the economics of the healthcare system of today are not sustainable. Certainly as business people, you are well aware of that. Escalating costs every year to a point that squeeze you to an area where it causes great concern, great problems for your business. So cost is the problem. And the ACA is a component of the response to it, but it is only one component. And there will be many other changes coming up over the next few years. Here's a couple of things to consider. 52% of all practicing physicians today are salaried. Approximately 80% of youngsters coming out of residency training, medical specialty, about 80% of them are indicating that their desire is to go into a salaried position rather than into solo or small group private practice. These are just some of the changes that will be reflected over the next few years. Major changes coming along. Today we are delighted to have guest speakers who are going to address some of the aspects of what is going on at this particular point in time. This is the second of what will be a series of seminars aimed at the business community. So there will be future ones. The questions will be coming along. Many of the answers are not yet out there. But as the answers become more evident, we will be presenting more of these seminars for the benefit of the business community in the future. I certainly appreciate all of you for coming today. Our guest speakers today, Joyce Gaines from Alkali Benefits and Insurance System will be our leadoff speaker, and then Jeff Barnett from Blue Cross Blue Shield will finish up. Following the presentations, we will then have a question and answer period for all of you. So if you would, hold your questions, and we will have a Q&A session that will follow the two presentations. Thank you for being here.
Good morning. We're glad everybody's here, bright and early. Thank you so much for joining us. I'm Joyce Gaines with Alkali Benefits, and our specialty, we're really a boutique benefit broker specializing in the very audience that we're going to be addressing today, and that's small to medium-sized companies. And this is often an underserved market, so it's sort of near and dear to us and to our hearts. I'd like to start today just by talking about really where are we as far as healthcare cost in our country. Most of you are aware that about 150 million employees receive their health care through the employer. So it's the largest source of health care today. Unfortunately, health care spending has more than doubled from 1996 to 2006, and the country currently has spending about 17.6% of the gross domestic product on health care. That is slotted to be around 25% by 2025. Now, one of the biggest problems is, as a country, we spend between 50 and 60% more per unit of health than any of the industrialized countries. And one of the reasons for this is we don't regulate healthcare pricing. Many of the countries are going to be regulating it much like it's a utility. But because we don't do that, you've probably seen the articles about an appendectomy. It can be all over the map. It can cost almost nothing, or it can, practically cost your firstborn child. So it really is, there's no regulation whatsoever. Because of this, it's not uncommon for a hospitalization in the U.S. to cost about 3 times more than the hospitalizations in industrialized countries. So, we also spend about $700 billion on unnecessary tests and services. About half of this comes from really poor lifestyle choices. Obesity and smoking comprise about $300 billion of that unnecessary spend, and the rest of it is just overutilization of tests, hospitalizations, and so forth. So, what does this look like to a major employer? Let's just take General Motors alone. For every car that rolls off the assembly line, General Motors has to add about $1,500 or $2,000 to the sticker price. That's more than the cost of steel. So what do you think this is doing to our competitiveness in this global economy? It's certainly not helping. So to sum up where we are, employer-sponsored health insurance premiums have more than doubled over the last 9 years, and they are increasing at a rate that's about 3 times faster than the cumulative wages. So, let's look at where we are today. Obviously, we are about 3+ years post-enactment, and we are about 3.5 short months away from the first enrollment on October 1 of this year out on the exchanges. As anybody could expect with legislation that is this sweeping, this global, this comprehensive, there's going to be some unintended consequences that all of us as stakeholders are going to have to deal with. And when I say stakeholders, there's not a person in the room that won't be involved. We have certainly the provider community, we have the insurers, we have employers, employees, we have individuals that are going to be subject to the mandate, and certainly brokers who are guiding and directing the small to medium-sized businesses. So we're really all in this. Funding and operating the exchanges is one of the near-term concerns. I think the states realize this, and the majority of the states have defaulted to the federal government to run their exchanges. And even the Obama administration back in April they sent out a notice that even the guidelines are a little too daunting for themselves, and they are not going to be able to open the SHOP exchange. That's the Small Business Health Option Program. It was supposed to be rolling out in January, and it's being pushed to 2015. So from a consumer standpoint, what we really need to brace ourselves for is cost shifting. The ACA clearly was established to help increase the number of people that have access to care, and it was to make perhaps care more affordable for the older and the sicker populations, but with some things that Jeff will be discussing having to do with underwriting, we're going to see, I think, some cost shifting to young, healthy people as well as to small businesses. And that's, again, one of the unintended consequences. Now, key provisions for 2014 and beyond. First and foremost, every U.S. citizen has got to maintain minimal essential coverage or pay a penalty. Now, the penalties for the individuals are not that onerous. The penalties for the employers are pretty onerous, and we'll get into that in just a minute. The carriers have to make sure that all of the plans are guarantee issue and guaranteed renewable. Again, the public exchanges have to be up and running on October 1. And one of the really positive things that came out of the ACA that I don't think is getting enough recognition, and that's the employer tax credit, the small employer tax credit. Here's the way this works. If an employer has 25 employees or less, and if those employees average $50,000 or less annualized salary once the employer takes his or her salary away, then that employer may qualify, and that's the operative word, may qualify for a tax credit that starting in 2014 will pay up to 50%. It will reimburse as a credit up to 50% of any of the monies that that employer has spent on health care. So that's really important, and I advise all of my clients who may be in that category to seek counsel from their CPAs and their accountants, because one of the things that I first and foremost tell people, I'm not an attorney and I'm not a CPA, so we try to guide our clients back to their tax advisors for that particular issue. Other parts of the Affordable Care Act, obviously waiting periods can't be longer than 90 days now. Two of the largest changes will be essential benefits. There are no more lifetime or annual maximums. Right now, a lot of the individual plans have maximums of a year or 5 years or whatever. Well, that's going away. It's going to be interesting to see what happens to some of the old grandfathered union plans. I saw a plan not long ago from the Plumbers and Pipe Fitters Union. The premiums were absolutely dirt cheap, but it didn't really pay for anything. It had a $250,000 annual limit. Well, if you have a double organ transplant, I think that's probably just going to be the tip of the iceberg. So it's going to be interesting to see what happens to those plans. And then pre-existing conditions have to go away. There's not going to be any pre-existing illness conditions whatsoever. Nobody can be kept from having coverage because of pre-existing conditions. So removing the lifetime and annual dollar limits and removing that pre-existing piece is going to be very costly, and I think we're going to see the premiums changing because of that. Not long ago, I read that the Congressional Budget Office has come up with numbers for the minimal requirement to meet some of these regulations and some other ones that we'll be talking about in a minute. And they think that the minimum amount to be spent to be compliant will be about $4,750 for an individual and about $12,250 for a family. So it's not seeming quite as affordable as we had all hoped. Now, essential health benefits. Most of you have probably heard about what these are, and this is only going to be something that individuals and small businesses need to worry about. By small business, I mean employers that have 49 employees or less. If you fall into either of those categories, then you must be compliant with having a plan that has these 10 essential benefits. If you've had group coverage and currently have group coverage, you're really not going to see that much change. Perhaps one of the biggest change, and it's very positive, is the expansion of the preventive and wellness services, and those are absolutely no cost, and I cannot encourage you enough to make sure that you're taking advantage of these, that your employees are taking advantage of these, because it's certainly better to find out that you have something that needs to be taken care of rather than waiting for a catastrophic illness. Included on the new list are things like adolescent depression. You can check for that, and there's no cost. Checking for diabetes and body mass index for kiddos. So these are very positive changes, and we think that's a step in the right direction. From an individual who holds individual coverage right now, they're going to see some significant changes. Maternity will be covered. Things like rehab, mental health and substance abuse coverage, all of those are new under the essential health benefits. So, if we look at the other things that small businesses and individuals have to comply with, in addition to the essential health coverage, they've got to satisfy certain deductibles and out-of-pockets. One of the biggest changes moving forward for 2014, even co-payments have to be factored in. So, the plan design will have to accommodate that. There's also going to be actuarial values, and I like to think of an actuarial value as it's the percentage of total plan cost, average total plan cost that an employer is going to pay. And they're going to be portrayed in four levels, four metallic levels, bronze, silver, gold, and platinum, with 60% actuarial value being perhaps appropriate for an employer that has minimum wage workers. It would be easier for them to afford the other percentage that they're going to need to pay. The 90% may be more appropriate for highly skilled workforce, but again, they're going to be the prices for these are going to vary by carrier. There are three proposed approaches that an employer can have for choosing plans. Number one, they can customize plans based on the needs of their workforce. Number two, they can choose a metallic level. Or number three, they can go ahead and just use a defined contribution approach. They can give their employees X amount of money. And as long as they're consistent and they give every employee the same amount, that is certainly one option. And letting them go out to the exchange and buy what is meaningful and relevant to their family and their family's needs. Now, when it comes to premiums, I'm going to wait and let Jeff talk about the rates. There's a huge sea change in the way that the underwriters are pricing these plans, and I think it's more appropriate for Jeff to cover that. The next slide talks about what are the requirements for companies that have 50 or more employees? The things that I've just talked about are for individuals and for companies. And by the way, just show of hands, how many of you are with companies that have below 49 employees or below? All righty. How about 50 and above? All right. There's a good mixture here. So if you have 50 or more full-time equivalents, you have to be compliant with the mandates under the ACA, the pay or play mandates. And I think it's really important to caution companies that when you think of 50 employees, it's 50 FTE equivalents. So you have to add full-time, part-time, seasonal, interns. If there are hourly workers, you even have to count the hours that are perhaps not worked, but that are paid for. And that includes holidays and vacation days and military and jury duty. All of those things have to be counted into the hours. One other piece of the equation that is really important, and that's commonality. If there is a McDonald's franchisee and he or she owns 2 franchises, each with 30 employees, then that looks like and will be dealt with like a company that has 60 employees. So they will be definitely having to be compliant under the mandate. There are 2 penalties, and we kind of like to look at them as penalty A is sort of a sledgehammer penalty. That's the gotcha. That's the one that you don't want to have to incur. And under this penalty, if the employer does not offer coverage and at least one full-time employee goes to the exchange for a tax credit, then the employer has to pay a $2,000 penalty for every single employee in that organization, with the exception of the first 30. So you get a pass on the first 30. So let's take a company that has 100 employees. You back out the 30. If they don't offer coverage, then 70 employees times 2,000, that's a $140,000 penalty for that company. The next penalty is, at Alkali, we sort of look at this as the scalpel. It's not the sledgehammer, it's the scalpel. And this is if you do offer coverage, but that coverage is deemed to be either unaffordable or it is deemed to be not adequate. And unaffordable means that it's going to be more than 9.5% of the employee's W-2 earnings. Adequate means that it's not going to meet that 60% actuarial value that we talked about a few minutes ago. So in this instance, even if a person offers coverage, but if at least one full-time employee goes out to the exchange and gets a tax credit, then the employer has to pay $3,000 times the number of people that have actually done that. And so that obviously you don't want either of these penalties, but that penalty is less onerous. Now, there are numerous safe harbors that are being bandied around, from using staffing companies for all of your part-times, using perhaps 1099 workers. And I must caution you, there is a lot of misinformation out there about workarounds. In fact, we have a new client that just joined us. He had been told, he'd been given some misinformation and basically was being set up for about almost $1 million penalty. We helped give him the guidance that he needed, and now that obviously he's going to stay out of harm's way. So when you start dealing with the workarounds and the safe harbors, please be very careful to use a broker that can guide you and give you the right information. Checklist for what you should be doing right now if you have 50 employees or more. First of all, know that you have 50 employees or more. Start tracking your numbers right now. And the way it's going to work, there's a look-back period of either the entire year of 2013, or there can be a look-back of 6 consecutive rolling months. Make sure when you work with your broker that you are developing coverage that is affordable, coverage that is adequate. Make sure that there's waiting periods are no more than 90 days. And do any of you have limited benefit plans, mini-med plans? Okay, looks like one person is. Those will have to go away. They are not going to be compliant under the law because of the prohibition on lifetime and annual limits. There are some plans being developed called skinny plans, and it looks like it's going to work around the first sledgehammer $2,000 penalty, but it's probably not going to work around the second one. And I think the jury's still out to see if these plans are going to be acceptable. So, there's been a lot of compliance, a lot of talks about what you have to do, and I think the important message that I want to share with you today, there are so many positive things that you can be doing as employers to look at some creative solutions, to look at things that will put you perhaps in a better place starting in 2014. And one of these is to possibly consider self-funding. Now, there's nearly 20 million Americans who work in businesses that have 49 employees or less. And out of these businesses, 70% of them do offer health care. A recent Kaiser Family Foundation study showed that only 15% of employers last year that had 200 employees or less actually avail themselves of self-funding. The carriers understand that the ACA penalties and mandates can significantly harm companies that have, say, 100 employees or less, and they've developed some very creative plans. Jeff and I were talking yesterday, Blue Cross Blue Shield is in the process or has already developed a plan. So we're seeing interest in companies that have as few as 25 employees. I think the Blue Cross plan has a self-funded for as few as 10 employees. But it's not a silver bullet. These plans are not for everybody. And I think the main message that I want to leave is that it's a longer-term approach. It's not a quick cure. So please work very carefully with your brokers to see if it's suitable for your company to consider a self-funded plan. Some of the advantages of self-funding, predictability, flexibility, control, all of these things can be increased under a self-funded solution. Again, you can avoid and minimize some of the PPACA mandates. Under self-funding, you don't have to adhere to all of the essential health benefits, nor do you have to adhere to the community rating, which Jeff is going to get into in a little bit. You're going to find greater flexibility of plan design. You'll find improved cash flow. And one of the pieces that I like, you really get access to claims data, and that's going to enable you to really know what's going on within your organization. And you can mirror that analysis of claims data with wellness plans that help you to get your employees into a healthier place. And back to Dr. Fleming's comment, that's what it's going to take to start improving cost and holding those costs down in our country. I've saved the best for last. And that's wellness and prevention. And what we're finding now is that companies are increasingly embracing wellness and prevention. They're using carrier programs that are already out there. Blue Cross, I know, has a wonderful wellness program, and they even give discounted gym memberships. And until we began to change the poor behaviors of the workers, we cannot affect a lowering of healthcare cost. We have got to start addressing the poor choices, the unhealthy behaviors. And that starts with awareness. One of the best things that an employer could do would be to go out and invest in biometric screening for the employees so that they know that if they have cholesterol issues, they know if they have blood pressure issues, and they can begin to deal with it. I always encourage my clients to really push preventive screenings. They're absolutely no cost for woman visit, baby visits, mammograms. There's a host of services out there that used to cost something. It doesn't even cost a copay now. So I often encourage my clients, if the employee comes in and shows that they've had a mammogram or a woman visit, give them half a day off. Let them bank half a day off, or give them a couple hours off early on a Friday. Make it worth their while to go out there and get that preventive screening. There was a study that came out last year by the National Business Group on Health, and it's showing that in 2013, 48% of all employers are using negative and positive incentives tied to the use of wellness programs. And I'll give you a perfect example. Now, I'm a former teacher, so I love the carrot. Whenever I can, I try to dangle that carrot, but if that doesn't work, I will bring out the stick. And Baylor Hospital System and the County of Dallas are now charging $650 for every smoker. If you're a smoker and your wife's a smoker and you have a 22-year-old child who's a smoker, that can get pretty costly. So I think that's a good step in the right direction. And make sure, if you are embracing wellness and you have like a weight loss contest at work, really give credit for activity, not always results. If you take somebody my age, what length of time does it take to lose 10 pounds versus a 21-year-old? Obviously, the 21-year-old, that metabolism's going, and they're going to lose that weight a lot faster. So please encourage everybody to just get some skin in the game. Let's look at what these lifestyle risks look like. This is what your typical workforce looks like today. And it's probably no surprise that 56% of your population is at risk for their nutrition choices. Here in Dallas, we're just probably one enchilada platter away from being into that 56%. And we really need to stop and start thinking that it adds up. Right now, we have 69% of the population is either obese or overweight, and that's costing our country $147 billion annually. The second big risk is physical activity, or lack thereof. We have become an increasingly a sedentary society. This past weekend, my husband and I were coming back from a movie, and we drove into our neighborhood, and I saw kids playing out in the yard. We almost threw on our brakes. I said, this is fabulous. They're out playing. They're not, dealing with their electronic games, and we need to see more of that. We need to get the kids up and out and get them to moving. Stress is the third largest risk. We are a society, unfortunately, that seems, it's difficult for us to say no, to not put more on our plate at work, to not put more on our plate as parents and as family members, so we need to be sure and start doing something to control the stress. And then the fourth one is smoking. Now, fortunately, tobacco use is coming down as far as the percentage of the population using tobacco, but it still costs our country about $150 billion a year. So these are choices, these are behaviors that are going to map to some very serious clinical risks. So again, it's probably not surprising that the number one clinical risk is body mass index, and this is not just for kiddos, not just for adults, it's for kiddos as well. Probably everybody in the room has been reading about the increased incidence of obesity in children, of diabetes in children, and it all maps back to this body mass index. Blood pressure, that is the silent killer. That's why I want employees to go out and know if they have blood pressure issues and know if they have cholesterol issues. If you know it, you can deal with it proactively. The rest are cholesterol related, and I think the big takeaway from this slide is these are not one-off things. They're not like a knee surgery or having a baby. Those go away. These are ongoing chronic diseases. They're costly to the entire population, and they are going to be undermining the well-being of your employees. So, let's take a look at one last slide before I turn it over to Jeff. Why wellness and why now? I think it's obvious that a proactive approach to health is going to be a triple win. The employee's going to win, the employer's going to win, and even the dependents are going to be winning, because let's face it, if you've got an employee that smokes and he or she quits smoking, well, there's a good chance that other family members may come along. If they change their diet, other family members may come along. From an employer's perspective, if you embrace wellness and you put a wellness program in place, it can reduce absenteeism, improve productivity. It certainly helps to position you as an employer of choice. Now, studies have shown and there's so many studies on wellness, but for every dollar spent on wellness, if the wellness program is set up properly, there can be a reduction of healthcare costs and a reduction of absenteeism. So, in closing, with all of the the mandates and the things that we're going to need to be watching out for. There's certainly a lot of unanswered questions on how the ACA will roll out in the months and the years ahead. But I think it's important that we need to stop and think about all of the positive things that we can be doing as employers to help improve the health of our number one asset, and that's our employees, and to help be an impact player in bringing down the healthcare costs in our country. So with that, I'm going to turn it over to Jeff.